All right, I'm Jerry Nelson. I'm a professor, clinical professor at the University of California, San Francisco in the orthodontic division. And a few years ago, I traveled to Seoul, Korea and met Dr. Kwon, who's the inventor of the Kilbon appliance that we're talking about today. And it's a really interesting and unique appliance that I learned about. I since then have done some research collaboration with him, and we published an article together. And this appliance is something that orthodontists have been trying to do for years. We have patients with very protrusive teeth, and we want to move them back, and we want to move them up. And we've tried for years to do that with things like headgears, like this device here, which is sort of a torture device for patients, unfortunately, but works, but we would prefer not to use that. The Kilbon device has another benefit, and that is that no braces are actually involved on the front teeth. So everything's done from behind, so the patient gets to have a reasonable smile during the treatment. I also found that this device allows very direct and constant movement so that there's no sort of stop and go kinds of movements. So I've been very pleased to be part of the initiation of using this appliance at University of California. So
so why is the Kilbon protocol a benefit to the patient?
The main benefit for the patient, I feel, is that it's so effective. It can move the front teeth back further than we can with regular orthodontics. The other thing is, the huge benefit is a lot of these very protrusive cases where the teeth are just sticking out way too far have to be treated with a surgical procedure. So in other words, we go inside the mouth, actually section the jaw off from its base, move it back, and the patient has to go through general anesthetic. They're in the hospital, and it's extremely expensive, and it's not always covered by medical insurance. So it can really be a problem, and sometimes patients are just up against a brick wall because they can't afford to do it. This particular way of moving the teeth back and up is so effective that it can be done without surgery. So for many patients that need this jaw surgery, it won't be necessary. And this is a very important thing, I think, for patient care in general, for the expense that we all suffer as citizens because we are funding these kinds of surgeries. And so I think that this is going to offer something really remarkable to all the patients that have serious malocclusions.